Jo wiped sweat from her face. She was helping a cow give birth on her uncle's farm in Montana. The mother cow was having a hard time. Jo spent many hours in the birthing area. There was fluid and dust all around her. She did not wear a mask or gloves. This was normal work on the family farm. Jo was on summer break from vet school. The day was hot. Jo had been at the farm for 3 weeks already. She loved working with the animals. Her uncle Tom owned many cows, some sheep, and few horses. Jo wanted to be a vet when she finished school. That is why she spent every summer at Uncle Tom's farm. She learned a lot by helping the animals. This cow was special to Jo. She had helped care for this cow since it was born 3 years ago. Now the cow was having her first baby. The birth was taking longer than normal. Jo stayed with the cow all night. She kept the cow calm by speaking in a soft voice and patting her head. "You are doing so well," Jo said to the cow. "Just a little longer now." Finally, after many hours, the calf was born. It was a healthy female calf. Jo helped clean the calf. She made sure the calf could stand and drink milk from its mother. Jo was very happy but also very tired. She went back to the farmhouse and fell asleep right away. The next morning, Jo helped clean the birthing area. She picked up all the dirty hay and birth material with her bare hands. Dust flew around as she swept the floor. She did not know that dangerous germs were in the air and on the material. Life on the farm continued as normal for the next 3 weeks. Jo helped feed the animals. She fixed fences. She cleaned stalls. She also spent time with the new calf, who was growing stronger every day. Then one morning, Jo could not get out of the bed. Her head hurt very badly. Her body felt hot, like it was burning. She coughed and coughed, but the cough was dry. "I think I have the flu," Jo said to her roommate Lynn. "I will be better soon." But Jo did not get better. Her fever went up to 103 degrees Fahrenheit and stayed there. She felt more tired than she ever felt before. Her muscles hurt. Sometimes she felt confused and could not think clearly. Lynn said after 3 days, "You need to see a doctor. This is not normal." Lynn drove Jo to the urgent care clinic in town. The waiting room was full of people, but Jo looked so sick that the nurse took her in right away. The doctor asked, "How long have you been feeling this way?" Jo said between coughs, "About 3 days now. I'm so tired. These headaches will not stop. It feels like someone is hitting my head with a hammer." The doctor wrote down all Jo's symptoms: high fever, bad headache, extreme tiredness, muscle pain, confusion, and a dry cough. The doctor asked, "What do you do for work?" Jo said, "I am a vet student. I help on my uncle's farm on summer break." The doctor asked with more interest, "Have you been near any farm animal giving birth lately?" Jo replied, "I helped a cow giving birth about 3 weeks ago." "Why is that important?" The doctor said, "I need to test your blood. Your symptoms and what you did match with something called Q fever. It is an infection people can get from animals, especially during birthing." The doctor took some blood from Jo's arm. He gave her medicine for the fever and told her to drink lots of water, and asked her to come back in 2 days for the result, and advised her to rest as much as she can until then. 2 days later, Jo returned to the clinic. She still felt very sick. The doctor had her test results. The doctor said, "The blood test shows that you have Coxiella burnetii infection. This is so-called Q fever. The germs were likely in the birth material or dust you breathe in while helping the cow give birth." Jo had never heard of Q fever before. She asked, "Is it dangerous?" The doctor said, "The good news is that we found this early. You need to take these antibiotic pills called doxycycline. Take them twice a day for at least 2 weeks, maybe longer based on how you get better. Joe did not like taking medicines but was happy to know what was wrong and how to fix it. The doctor said, even with medicine, you might stay tired for weeks or months. Q fever is not very common, but it happens on farms. The germs can live in dust and dirt for months. Next time you help animals give birth, wear a mask and gloves. Wash well after. Joe took the medicine exactly as the doctor said. Slowly, she started to feel better. The fever went away after a week, then the headache stopped. The tired feeling lasted longest of all. It was a month before Joe felt almost normal again. When she felt strong enough, Joe went back to her uncle's farm. This time, she brought a box of face masks and many pairs of gloves. Joe said to her uncle, "We must use these now, and we must be more careful with birth waste. The germs that made me sick came from the cow birth." She also showed him articles about Q fever on her phone. Uncle Tom said at first, "That is nonsense. I've been farming for the 30 years without mask or gloves. Never got sick." "You were lucky," Joe said. "I got very sick. The doctor said Q fever can even become chronic and affect your heart if not treated. Please just try the new safety steps." After hearing how sick Joe had been, Uncle Tom agreed to try. Together, they made new safety rules for the farm. Always wear masks and gloves when helping animals give birth. Throw away birth material in special bags and burn them. Keep barn clean to reduce dust. Limit who can enter birth areas. Wash hands and change clothes after working with animals. Clean tools with disinfectant after use. It took time for everyone on the farm to get used to the new rules. Some workers thought the masks were uncomfortable, but Joe kept explaining why it was important. Joe told the farm workers, "These tiny germs can make you very sick. You cannot see them, but they are real." By the end of summer, everyone was following the new safety rules. No one else got sick. The farm was very clean than it had ever been. When Joe went back to vet school that fall, her professor asked students to share summer experience. Joe told her classmates about getting Q fever and what she learned. "Always protect yourself when working with animals," Joe said to the class. The professor said, "Zoonotic diseases are illnesses that can pass from animal to human. Q fever is just one example. There are many others like rabies, Lyme disease, and salmonella." Joe professor was impressed with her story. Joe has learned a valuable lessons that will make her better veterinarian. Safety must always come first. Joe went on to study more about zoonotic diseases. She wanted to help other farmers and animal workers to stay safe. She knew how to respect the tiny germ that can move from animal to people and cause big problems. When Joe graduated from vet school 2 years later, she went back to work in her hometown. She helped many farmers set up better safety system. Joe turned her bad experience into a way to help others. She never forgot to wear her mask and gloves when helping animals give birth.